Hello, I'm Victoria Johanovic. I'm in the healthcare management program here at American University. I live around the Maryland area. I went to school in South Carolina and I got my bachelor's of science in experimental psychology. For a little bit, I was thinking about going to med school. After college, I was still trying to figure out what I wanted to do. So I went to work for Providence Hospital, which is located in DC. It no longer operates in the capacity it did when I worked there, but I was a scribe for the emergency department as well as a gastroenterologist. So those two experiences have really opened me up to the behind the scenes of healthcare, as well as getting to know personally what the physicians and clinicians and staff of hospitals do on a day-to-day basis and how healthcare policies implement and affect their practices. So I think those experiences have really led me to the healthcare management administration side. I am currently working for Beata, which is a home healthcare company here in Maryland, and my role focuses on customer satisfaction, scheduling, implementation, and really coordination of care and planning among clinicians and contacts, as well as working with referral sources. My interests include I love watching TV. I'm pretty big into art, and I think activity wise, I really enjoy doing yoga. And as well, I sometimes enjoy playing tennis when the weather is nice. But really, anything that's relaxing because day to day work and doing school, things that help me take my mind off things that are going on is what I really enjoy as of now. I've never had previous consulting experience. I actually have a lot of friends from school who went in to consulting after college, and it's always kind of a joke of, what do you do? And they say, I don't even know. So I'm really interested in seeing how this course lays out consulting and how it can benefit, really, I think, anyone in any field, because consultations are constant, whether you are under the title of consultant or not. Um, my ultimate dream job, I think, really primarily from working in a hospital setting versus working in an office setting. I really enjoy the hospital setting. I want to focus on patient outcomes and patient experience, and also ideally working with government in some capacity to really get people who are underprivileged or impoverished the type of services that could benefit them in the long term and ultimately decrease the healthcare spending in the United States, which is obviously a big topic. So I think, when looking at consulting, you're looking at areas where healthcare organizations can implement things such as technology. I think that's one of the huge things. If we can implement more of that in every area of health care, then there could be drastic cost saving measures if implemented correctly and thus consulted throughout with the organization. At least one challenging situation where I had to provide advice to solve a problem. I mean, I think that comes through and through with everything. And sometimes those bigger challenging situations are often not related to your job or school or situations such as that. So I would think one of the most challenging situations I've ever been in was working at the hospital I was. It is very difficult to the patient population to sometimes always act in a polite manner or always act in the best manner, I would say, because a lot of the patients can become volatile at sometimes aggressive. And can be kind of rude to the clinicians that are trying to help them. And I think there was multiple situations at the hospital where the advice I had to give was basically, okay, let's just do the best we can. Let's not get antagonized in this situation. Let's see how we can calm the client, the patient, and let's continue on so we can help the other patients that are with them as well. And I think that was a pretty big part of what was my consulting experience is basically problem solving among clinicians and the patients, because in my role I'm kind of always been the middleman. So gaining both sides, trying to find a solution to not only get the job done, but to do it effectively and with quality and care. So I think the biggest way to encourage someone to accept your advice, and along my path I have learned, especially dealing with customers, whether in healthcare or outside of that, you really have to be a lending ear. You have to listen. You have to give the person the time to talk in order to understand their frustrations, or in situations what they're trying to communicate, because often we listen, but we listen to what we want to hear and not what they're actually saying. And that's just something I think from my psychology background that has really been a big implementation in my work today, is giving someone the time to participate in the conversation without running them over, and then really understanding all sides in order to come to a final conclusion. And from those tiny experiences, I think you can often deal with people who may be disinterested in your point of view, in your strategies, and through that, you either have to persevere, or you can let it defeat you. And I think that's one of the biggest things I've learned from my past experiences, and trying to implement that in everything I do now, especially because I'm working on that customer service aspect of things. And I think that has really evolved into what I see as healthcare management. It's no longer a healthcare caring situation. It's become a business, and the patients are in fact the clients, but you also have to look at the clients of the hospital, which are the physicians, the staff. And I think there's kind of that dichotomy and double-edged sword of keeping one happy while you also keep the other one happy. And that's a big problem in healthcare, but I think that those balances can come through implementation of strategies and technology and innovations that can be brought through consulting.